During the holiday season, some doctors say there's a chance for increased risk of stroke. And here with more on the added risk factors to look for this time of year and why you shouldn't delay treatment is Dr. Chris Burke, the chief of neurology at Rochester General Hospital. Dr. Burke, good morning. Thank you so much for joining us.
Good morning. Thank you.
So we know, or do we know for sure, that there is an increased risk of stroke with stress? Has that been proven to be correlated?
That has been proven. Actually, it's one of the top 10 risk factors or factors associated with stroke that we've identified. And certainly around the holidays, and particularly Christmas Day and even New Year's Day, we see an increased number of strokes. In part, that's due to the stresses associated with the holidays.
So listen, Dr. Burke, I mean, normally Christmas and Thanksgiving and all the holidays can be stressful as it is under normal circumstances. This seems to have truly exacerbated things. And we may not have to be around family, which can be stressful in itself, but then not seeing family can be stressful. On top of that, some people are probably worried about their businesses, their jobs, their families, their health. So what are some warning signs of stroke that people should be looking out for this time of year?
Yeah, well, we always use the acronym FAST, F standing for face, which would mean facial droop, ARM meaning arm weakness or numbness, and S standing for speech or slurred speech. The T stands for time, as in you don't have a lot of time. You call 911 if you have those symptoms come on acutely. Chances are good, 70% or greater with one of those symptoms that you are having a stroke.
So you mentioned time. So if you're feeling any of these symptoms, call immediately. But how long do some of these symptoms take to even come on or notice? Is it something almost immediately you'll start to feel?
In fact, that's why it's called a stroke. You are struck down with these features. And unlike many other conditions, or some other conditions anyway, there's rarely a warning sign for stroke. And when it happens very quickly, abruptly, and there's very little time to potentially intervene on that stroke, stop it from progressing. And that's why we have our folks call 911 as quickly as possible.
Is there any sort of, I know some cancers, we know you're at a higher risk if it runs in your family. Is that similar to stroke, or can it strike anybody at any time at random?
Well, of those many risk factors for stroke, some of them are familial in origin. And so those of us who have higher risk of stroke might also have a higher family risk and history of stroke going on as well.
Dr. Burke, I think this is really important to talk about. How can we prevent or help try and prevent symptoms of stroke or stroke in general?
Well, it's no different around the holidays than it is any other time. But the things that we want to key on around the holidays, first of all, are probably things we already think about already. We tend to overindulge both in food and alcohol. We want to do those things more in moderation. Things we might not think about around the holidays, poor sleep and not giving enough time for rest and relaxation. Additionally, we tend to get a little loose with our medication taking. And so this is a good time of year to be very vigilant about taking our medications and not missing doses. And finally, when it comes to those psychosocial stressors, I think that this is a time of reflection, time of the year where we can be a little bit more gentle on each other and on ourselves.
Maybe a little yoga, maybe some meditation. Those things help for everything, but I think it's actually good for your health too, especially trying to prevent stress, right?
I think exercise is a great idea. Sedentary lifestyle is associated with the increased risk of stroke. This is a great time to get rid of some stress and take off some of those pounds and work off some of that extra food. So get out and exercise at least 5 out of 7 days a week.
Yeah, it's a win-win. We know it increases serotonin levels as well, and with the gray and seasonal depression kind of settling in, it's just a win-win to get off the couch. Dr. Burke, thank you so much for joining us this morning. Really important signs. Where can people learn more if they have any questions?
Well, you can certainly go to the American Heart, American Stroke Association. They have plenty of great stuff that's on there. And believe it or not, most heart healthy things are stroke healthy things too.
All right. Fantastic. Dr. Burke, thanks so much and happy Thanksgiving.